Imagine a patient coming in for a dental treatment. Everything seems fine until suddenly they have an allergic reaction mid-treatment. What's happening? This is a type 1 hypersensitivity reaction, also known as cell-mediated or immediate reaction. It's a rapid and potentially life-threatening allergic reaction. To understand what happened, let's break it down into steps. Please watch the short introductory video that I posted on hypersensitivity before you begin with this one. We'll take latex as an example of an allergen to see what happened. Latex is a natural rubber derived from the sap of the Hevea brasiliensis tree. It's commonly found in gloves, rubber dams, syringes, balloons, and elastic bands. When latex gloves are worn, latex proteins from the gloves, which are the allergens here, can either leach out and come into contact with the skin or become airborne when powdered gloves are used. The powder carries latex particles which also can be inhaled. While for most people latex is harmless, but for those with a latex allergy, their immune system misidentifies it as a threat, triggering an allergic reaction. For type 1 hypersensitivity reaction to take place requires two key steps: sensitization and the reaction phase. The sensitization phase occurs on the first exposure to the allergen, where the immune system encounters the allergen for the first time and mistakenly marks it as a threat. The reaction phase that occurs at the second exposure, when exposed again, the immune system overreacts, triggering an allergic response. Let's dive deeper into both of it. When a patient is exposed to latex for the first time in the sensitization phase, their immune system mistakenly identifies it as a harmful substance. Antigen presenting cells, which are already stationed in tissues such as skin, mucosa, lungs, and GI tract, capture the latex allergen and present it to naive T helper cells in the nearby lymph nodes. T helper cells release cytokines which stimulate B cells to turn it into IgE producing plasma cells. The IgE antibodies these plasma cells produce are specific to the latex antigen. These newly formed IgE antibodies now bind to FCER1 receptors on mast cells and basophils, waiting for the next exposure. At this stage, no symptoms appear. The patient is now perfectly sensitized to latex, meaning their immune system is primed for a reaction the next time they encounter the same allergen. After some time, the same patient returned for another treatment. You placed a latex rubber dam today. The patient's immune system remembers latex as the enemy, and those latex specific IgE coated mast cells are waiting for another exposure. This time, within seconds of placing the dam, mast cells explode, releasing histamine and inflammatory chemicals. Histamine here is the main culprit behind the initiation of the allergic symptoms. Histamine binds to its receptors on blood vessels, where they trigger vasodilation or widening of blood vessels and increased vascular permeability. This leads to fluid leakage, causing swelling in areas with high blood supply, such as around the mouth, leading to angioedema or deep swelling of tissues, on the skin, leading to hives or urticaria, in the throat and oral cavity, leading to swelling that may obstruct the airway. The reactive phase of type 1 hypersensitivity can be further classified into immediate and late phase reactions. Within minutes of exposure to an antigen, immediate hypersensitivity occurs and granules in mast cells burst, releasing histamines and lipid mediators that are tryptase, chymase, and heparin. All are responsible for the initial allergic reaction response. Histamine, as we said, causes vasodilation, vascular leakage, bronchoconstriction through smooth muscle contractions around the airway, and itching. Tryptase and chymase are protease enzymes released from mast cell granules. They break down proteins, leading to tissue damage and increased inflammation. Heparin is released from the granules of mast cells and basophils. It prevents blood clotting and increases vascular permeability, which contributes to more swelling during an allergic reaction. In short, these all, especially the histamines, are the instant responders that cause the first allergic symptoms like hives, swelling, and shortness of breath. The late phase reaction takes place within 4 to 12 hours after antigen exposure, and this may last from approximately 1 to 3 days. It is caused by the release of additional delayed mediators from the mast cells and basophils. The key inflammatory mediators in the late phase are the leukotrienes, prostaglandins, and cytokines. Leukotrienes causes smooth muscle contractions around the airway, leading to prolonged bronchoconstriction, mucus secretions, and inflammation. Prostaglandins enhance vasodilation and pain sensitivity. Cytokines attract immune cells and prolong inflammation. As these mediators spread throughout the body by the bloodstream, they target multiple organ systems, and in severe cases, they can cause an anaphylactic shock. Anaphylaxis is a life-threatening, severe, rapid-onset allergic reaction. It occurs when the immune system overreacts to an antigen, leading to widespread histamine release and massive inflammation throughout the body, and can cause multiple organ failure and ultimately death of an individual. Now, you may get a question here: why do some people have minor versus severe allergies? It all depends on a few factors like immune system sensitivity, amount and type of exposure, genetics and family history, route of exposure, and other health conditions like asthma or multiple allergies, which makes severe reactions to happen more likely. So, this is why some patients only get mild itching while others can go into full anaphylactic shock. Latex was just one example. Type 1 hypersensitivity can be triggered by many other things in the dental office. That's why taking a detailed allergy history is crucial before any kind of procedure. Now let's talk about managing a type 1 hypersensitivity reaction in the clinic. If the reaction is mild and the patient is only having hives, swelling, or itching, you can stop the procedure, give an antihistamine like diphenhydramine or Benadryl 25 to 50 mg, and monitor the patient for worsening symptoms. In severe reactions where you may think of an anaphylaxis, call emergency services immediately. Administer epinephrine and lay the patient flat and give oxygen. If you see no improvement, repeat epinephrine 5 to 15 minutes until help arrives. You can use either an EpiPen or administer a 0.3 mg intramuscular injection of epinephrine. Every dental clinic should have an emergency kit with epinephrine. If you think this video was really helpful, please like, subscribe, share, and comment if you have any questions. Thank you for watching.